Mohammed Nauman Saleem. He will speak on Unani medicine. He is presently working as assistant professor in the postgraduate department of Ilmul Saydala, Unani Pharmaceutics at one of the esteemed institutions of India, Ayurvedic and Unani Tibia College and Hospital, Government of NCT of Delhi, Karol Bagh, New Delhi. He formerly worked as a research associate at the Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India, through Central Council of Research in Unani Medicine under the, can I have some, under the NPCDCS AYUSH Integration Project. He completed his BU, MS and MD from the same Ayurvedic and Unani Tibia College and Hospital. By far, within a very short span of time, he participated in more than 30 national and international conferences, /seminar, workshops, and presented more than 18 scientific papers. 12 papers have already been published in the reputed peer-reviewed scientific journals with high impact factor. He is also a reviewer of papers of science domain. He authored 2 books, one of which has been published by a well-known publishing house in Germany and released worldwide. In 2018, he received the National Ayush Award from Ministry of Ayush, Government of India for the best research paper in the field of drug research and development. And he is here presenting his views on Unani medicine.
Thank you, ma'am. Thank you for the kind words. First of all, greetings of the World Holistic Health Day to all of you. I'm extremely thankful to the organizers, especially Dr. Shri, who has invited me in this seminar. So, first of all, I would like to say that I have worked at various levels, be it with the collaboration of WHO or Ministry of Health and Family Welfare or state governments or some other organizations, but I came across very often, you can say that everyone asked me about Unani system, that what is Unani actually, they didn't knew, and they always had that eagerness to know what we actually have in Unani system medicine. So I have tried to sum up, or we can say I have collected a lot of information about Unani system medicine as possible in this limited period to give you all an overview about this system. So as you can say that Unani system of medicine is a scientific medical system that provides comprehensive solution to various states, of human body. And it is one of the oldest systems of medicine in the world that is being practiced in predominantly all over the world and basically in Asian subcontinent. So as the name suggests, the Unani system medicine or the Unani tip has its origin or immediate origin to ancient Greece. And it has been recognized all over the world with different names. Some call it Tibbe Unani or Tibbe Nabvi or Tibbe Sunnati, Ionian medicine, Arabic or Greco-Arabic medicine, Eastern medicine, and even Uyghur medicine in China. So it is the only global system that has evolved in different parts of the world by imbibing the observations and experiments of various civilizations originating from, be it from the ancient Greece or in fact ancient Egypt and Mesopotamia, and enriched systematically through various parts of the world. So basically it deals with the management of health and diseases and provides preventive, promotive, curative, rehabilitative healthcare with a holistic approach. That is, we treat the individual as a whole, and we all have listened to Dr. Tuli in the first session about holistic health, so I won't be going in detail about that. But yes, I can say, according to one of the great philosophers or physicians of Unani system of medicine, that is Avicenna. He defined Unani medicine as it is the science in which we learn various states of body in health, and when not in health, the means by which health is likely to be lost, and when lost, is likely to be restored. This is one of the, you can say, better definitions of Unani system of medicine. So, going through the historical background, I won't be going in detail, but yes, I would like to share that the history of Unani medicine is traced back to 5,000 BC to ancient Egypt and Babylon, who used to take various plants as remedy for ailments and also initiated surgery as a method of treatment. The studies of various papyri clearly show the ability of Egyptians in the field of medicine and surgery. And thereafter, various evolutions took place, such as in 1200 BC, initiation of experimental methods to study diseases and their treatments by Asclepius. Asclepius is basically the, we can say, the pioneer of medicine in the world. One short instance I would like to share that we have read and we have in various books that Asclepius was a person who used to carry a wooden stick from Altai tree. Altai officinalis is a tree, and he used to carry a wooden stick, and a snake was wrapped around that stick. So I can say perhaps we have a logo of medical systems nowadays which depicts that physician or philosopher or Greek, we can say healer. So various milestones have been achieved during the historical period. One thing I would like to share that during the period of 460 to 370 BC, that is the period of Bucrat or Hippocrates, that we know as father of medicine. He is actually a father of medicine in Unani system also. He was a Greek physician, and he is not only the physician, we can say he is an era in himself. He was a dominating figure of classical period, and in fact he is he basically gave his theories on which the modern Unani system is still based upon. And he applied the systems, and by investigating the natural causes of diseases and recording the existing knowledge, and he set the ground for medicine to develop as a science actually. So, since then there have been various milestones, like we can say in 305 BC, Herophilus, who we know as father of anatomy, he did a large number of human dissections. And in 1st century, we can say for the first time a physician or a botanist, he compiled treatise, De Materia Medica, we know as Kitab al-Hashaish, which comprised of around 600 drugs. The writer of that treatise was Dioscorides. And since then the writing, we can say the writing culture in science and system of medicine came. And thereafter various physicians and various philosophers have been there, be it the Arabs or Persians. And then we can say 12th century or the late 11th century, the development of Unani system of medicine in India during the Sultanate period, it came. And in 1904, establishment of Hindustani Dawakhana, a pioneer industry, or we can say manufacturing unit, was set up by Hakim Ajmal Khan Sahab. I think we all know about Hakim Ajmal Khan. He was not only a Unani physician, but a great reformer, a socialist, and a great freedom fighter also. So Then in 1921, the inauguration of Ayurvedic and Unani Tibia College at Delhi was done by Mahatma Gandhi. And in 1926, a research committee for this Ayurvedic and Unani systems was developed at the same college. I would like to add one thing, that scientific research in Unani medicine was given a boost in India by basically Hakim Ajmal Khan, who was a versatile genius, and he, along with Dr. Saleem Siddiqui, a chemist, they undertook researches on important medicinal plants, one of which was Asrol. You all must have heard about Rolfia serpentina. So research was done on this Rolfia serpentina, and it is a benchmark in history of Indian research, and they successfully isolated an anti-arrhythmic agent which was named after Hakim Saab as Ajmaline. And various other alkaloids were also isolated, which were named as ajmalinine, ajmalicine, isoajmaline, neoajmaline, and others, which were used for the treatment of mental and cardiovascular ailments. So then after we had a setback, we can say, after during this post-independence era, where the writings and the research took a back seat. So we can say that is a dark period of our history. But then later on, as the researches and as the science evolved, in 1940 we all had that Drugs and Cosmetic Act, and then in 1964 a separate committee of Unani Pharmacopoeia Committee was set up by the Government of India. And then slowly and gradually the researches in these systems also started once again, and with the development of Central Council for Research in Indian Medicine and Homeopathy in 1969, which then bifurcated in 1978, and individual research councils were developed. So in 1978, the Central Council for Research in Unani Medicine took into existence, and then in 1983, a separate chapter, that is the chapter 4A, which we have in Drugs and Cosmetic Act today, that was included after the various amendments in the Legislative Assembly. So just going through this, I would just like to say that recently in 2014, the elevation of Department of AYUSH as a full-fledged Ministry of AYUSH took place, and then after that in 2015 a separate AYUSH Wellness Clinic was set up at President Estate also, and then declaration of Unani Day as National Day by Government of India, which is observed on 11th February every year. So now coming straight away to the theories and principles, I would just add that the concept of Unani system of medicine is divided into two parts, that is the conceptual or the theoretical that we say, and practical aspect. And the most important, we can say, principle of Unani medicine is the mizaj. We often ask people ke tumhara mizaj kaisa hai, theek hai? So we use these words in our daily life, but they really hold an important aspect, principle. They are a principle in itself. So the mizaj, which classifies human beings, diet and drugs into four quantitative types, that is hot and dry, hot and wet, cold and wet, and cold and dry. These are the four classifications of mizaj, and then different characters are found in people having different temperaments. That is why we have this holistic approach, and we have individual treatments for individual ailments. Like previous Dr. Rohit also said that we have individualized treatments in AYUSH pathies. So in Unani system also we have individual treatments. Suppose one medicine suits a person, that is not the case in every person will be benefited with the same medicine. So, yeah. And we also have one more important concept, the concept of health and disease, which is based on the theory of akhlaq, that is the humors. This theory was given way back in 460 BC, we can say, by Hippocrates only. And we still follow this theory of humors, that it is believed that the four humors, that is the dung or the blood, the phlegm, yellow bile and black bile. These are the four humors, the liquid fundamental substances of living things possessing the ability to support the biological processes, that is the life, nutrition, growth, sensation, movement and reproduction. So any disturbance in the equilibrium of these, we can say, humors causes disease, and hence the treatment aims at restoring the correct equilibrium of these humors. We also have this main concept of tabiyat or physique, or what we can say medicatrix naturae, that it is the supreme power of body. What is tabiyat? We often ask people, "Aaj tumhari tabiyat theek hai? Tabiyat kaisi hai?" So the tabiyat is nothing but we can say that the body's internal power, or now we can say the innate immunity, or the ability of body to overcome any condition, the self ability of any individual to overcome any condition, or we can say any what we think of any such condition that is not likely to the body. This Unani system, that tabiyat is the supreme power and controls all physiological functions of the body and provides resistance against the diseases, we can say. So this is very important. So that's how every individual, let's say he faces any medical condition or any infection. So first of all, what happens? The body itself tries to overcome that situation, that condition, and then when it fails, we help the body to restore normal functions. So that is the main principle. And one another principle of Unani medicine cover all we can say cover all medical fields and defines the factors of existence as umur-e-tabiyat, that is the fundamentals of physique, that the body is made up of these substances, and without these the structure, or we can say existence of body is really not possible. That is arkan, elements, mizaj, the temperament, humors, asa, the organs, the arva, pneuma, or what we discussed in the morning sessions as soul or atma, we have discussed. The earlier presenters also discussed about this. And then we have Puva, the faculties, the power of body, and lastly the functions of all these collectively. So these are the basic, we can say, fundamentals of physique. Now we also have principles of diagnosis, that the unique holistic diagnostics of Unani system comprises of proper history, that is the Ruda, history taking, then external examination, the physical examination, then moina and nubs, what we call pulse examination or stool examination. In pulse examination we can say that we can see the strength, rate, consistency, how a pulse is functioning. We have different parameters of pulse examination, and similarly in urine examination, the color, consistency, and we can say the turbidity or the udder, various parameters are there. And in moina baraz, that is the stool examination, these four we can say principles are the principles of diagnosis in Unani system of medicine. And then we have principles of treatment, the general principle of treatment, which evolves around that. The first and foremost thing what we do is the izala sabab, that is the removal of the causative factor. We try to find out the causative factor and we work on the removal of that causative factor, and that is only how we can achieve health, not merely by treating the symptoms for a short period of time, but actually working on the cause and removal of that cause. And then the second thing what we deal is the ta'deel-e-mizaj, that is normalization of the temperament that has been disturbed, normalization of that mizaj of that individual. And then evacuation of the morbid material. And then we come to ilaj bil zid, what we call as the hydrotherapy. Like in homeopathy, Sir said that similia similibus curantur. That is also one concept in Unani which is known as ilaj bil misl. That means the similar things cure similar conditions. But in certain disease conditions, we use ilaj bil zid. That is the opposites to treat any medical condition. So in ilaj bil zid or in therapeutics, firstly and foremostly what we do is ilaj bil ghiza. That is, we don't use any medicines. We try to normalize the condition and try to treat the patient with diets only. And if this is not possible, or if the condition is still prevails, so what we do is ilaj bil tadbir. That is, we follow different regimes, regimental therapy what we call. Regimes may be change of environments or change of other physical factors, or we can say other things that you must have all heard about that recently, hijama therapy or cupping therapy and other therapies. These also come in regimental therapies or ilaj bil tadbir. And then if our tadbirs or our regimes also fail, or we are not able to control the situation or treat that individual, then only we move to ilaj bil dawa, that is the pharmacotherapy. And the next and the last step we follow is the ilaj bil yad, or the surgery. And one thing I would say that the sources of medicines, various people have different questions about what sources we opt or what is the origin of these drugs. So around I say 75 to 80% of our drugs are from plant origin, and then the remaining 5% or we can say 7 to 10% animal origin and in mineral origin. This is also an important aspect of Unani system of medicine, that is the unique aspect of promotive and preventive healthcare. And for this, asbab sitta zaruriya, that is the 6 essential factors have been described in classical literature. These 6 essential factors, we can say, they apply at all places and in all ages, and every time, we can say, not only in disease condition but during the healthy condition also. One should take care of these 6 essential factors. That is, first and foremost, the hawa, that is, or we can say hawa muhi, that is pure air. And then makulo mashroob, that is foods and drinks that we take. Then bodily movement and repose, that is the harkat wa sukoon badani, bodily movements and rest. And then psychic movements and its rest. And then sleep and wakefulness, and retention and evacuation. All these 6 essential factors have to be taken care of, not only for treating any disease condition, but also for maintaining health, because these are preventive and promotive, we can say, factors. So let's discuss what are the strengths of Unani system of medicine. We all have listened to various talks since morning. That holistic approach is one, and then the unique concept of mizaj or temperament, and then promotive and preventive health aspect, and then cure of chronic ailments is one field for which various patients or various individuals approach Unani system of medicine. And then ilaj bil tadbir, or the regimental therapy, the immunomodulation concept of muqawwiyat, that is tonics, and the concept of accelerants, mufarrihat. These concepts are not there in any other pathy except Unani system of medicine. And if we see the treatment specialities in Unani system, so I have compiled a few systems where we hold command, or we can say we have lead in treatments of these conditions, like we can say in skin diseases, in musculoskeletal disorders, in cardiovascular, some cardiovascular conditions, sexual disorders, lifestyle metabolic disorders, neurological conditions, respiratory disorders, and very importantly digestive disorders. All these are different fields where Unani system of medicine has really exceeded and is doing well, and a lot of researches are going on in various parts, not only in the subcontinent but overall in the world. So just give you a basic idea about the framework of Unani medicine in India. We have the ministry, that is the Ministry of AYUSH, and the regulatory framework basically has the statutory or the regulatory bodies such as recently developed NCISM, that is the National Commission of Indian System of Medicine. Previously it was known as Central Council for Indian Medicine. Now it has been nomenclatured as National Commission of Indian System of Medicine, and the Drug Control Cell. And then the Act's rules we have is the education system regulated by IMCC Act 1970. The registration of practitioners is regulated by the same IMCC Act and other respective state acts. And the drug industry is regulated by the Drugs and Cosmetic Act 1940 only. And if you talk about the education and practice, so the academic programs have three main programs, that is the Kamilati Gujarat, that is the Bachelor of Unani Medicine and Surgery, a 5.5 years program, basically a graduate degree we can say, and then Mahir or Doctor of Medicine or MD Unani, and Mahir Jarahat, that is Master of Surgery or MS in Unani System of Medicine. And we recently PhD programs have also been introduced in Unani System of Medicine. And if we talk about the academic institutions, overall we have 54 colleges, 40 undergraduate, 12 offer both undergraduate and postgraduate courses, and 2 are purely postgraduate institutes. The National Institute of Unani Medicine is situated in Bangalore, and one more national institute is likely to open in Ghaziabad, NIUM Ghaziabad. And if we talk about the healthcare delivery, there are overall 259 hospitals, 1621 dispensaries, and around 51,000 registered practitioners in the country, and 625 manufacturing units of Unani medicine. Now talking about the research and development, the apex research organization in the country is Central Council for Research in Unani Medicine, whose headquarters lies in New Delhi only, and there are 22 centers all over the country in different places. Then the researches are going on are carried out by different postgraduate institutes also in the form of MD programs, various researches and various OPD researches basically are going on in these institutes. Then collaborative researches with different institutes such as ICMR, CSIR, AIMS, and we can say NICPR and other organizations. The collaborative researches are also being conducted. And then industrial researches are going on, according to which various patents and proprietary medicines are being introduced in the markets. And then researches at individual levels, that practitioners also, suppose in the form of case studies or case, we can say case forms, they are also doing researches. So all these researches are generally focused on either fundamentals of Unani system of medicine, or drug in standardization, or the drug dosage forms, preclinical aspects, clinical aspects, and literary aspects of Unani system of medicine. And then we have National Formulary of Unani Medicine, which is in 6 parts and describes about 1 to 2 line formulations, and the Unani Pharmacopoeia of India, which is in 2 parts, has 298 single monographs and 200 compound formulation monographs in that. Coming on to the global scenario, I would just say that Unani medicine has institutional frameworks in various countries, especially in the subcontinent. And also there are about 34 Unani colleges and 500 dispensaries. In Bangladesh, 19 colleges and various practitioners in Sri Lanka and other parts of this country. And if we go beyond the subcontinent, we say in South Africa, the School of Natural Medicine, Faculty of Community Medicine and Health Sciences, University of Western Cape also offers the degree course in Unani. In Iran, Unani medicine is practiced as traditional medical system, and there is a traditional medicine and materia medical research center established at a university in Tehran. And in Kuwait, also Unani system of medicine is practiced as different. I already discussed that various countries or in various parts of the world, Unani system of medicine has been practiced with different names. Like in Kuwait, it is practiced as Islamic medicine, or they have a separate center also. In UAE, the Unani system is practiced and allowed under complementary and alternative medicine system. And in Malaysia, the Unani system of medicine is recognized and practiced under traditional Indian medicine. So besides these, it is also recognized and being practiced in various parts of USA, also UK and other parts of the country. And if I can sum up, in around 85 countries of the world, the Unani system is being practiced. So coming on to the last aspect, I would say the future prospects, and I have worked in different parts and basically different organizations. So I came across various things. That is, firstly, we can have an integration of Unani system of medicine in the mainstream healthcare through the integration with different national health programs that government is conducting. Be it the national tobacco, national oral health, national programs for non-communicable diseases and others, where these systems have leads. So these systems can be integrated with the national health programs, so that we can strengthen our mainstream healthcare, and then inclusion in state program implementation plans, what we call as PIPs, and then starting multiple centers at various health facilities. Like the government has already worked upon it, and we have various centers in different hospitals of Delhi also. Let's say in AIMS we have a separate center for Unani, in Lok Nayak Hospital or in DDU Hospital or various other hospitals, RML Hospital. They, all these hospitals house a separate OPD and a separate space for Unani system of medicine. And then we can also, promote pluralism in healthcare through cross referrals. This can also be increased for the betterment of the healthcare of the country. And obviously we can promote collaborative researches with other biofields, and we can also work upon the novel dosage forms and promote the industrial research. And what I think that wider documentation projects and promoting international cooperation is also one aspect that we can exploit for the, we can say, development of these systems of Indian systems of medicine all over the world. So thank you for your patience. And
thank you.
We can say the approach or the place where we are living. So I think we all have witnessed and we all saw that during this pandemic various other systems of Indian systems of medicine were how they were roped in to face this situation of pandemic, and we all did really well with a collaborative approach. So I think this integration shall be promoted not only during pandemics but also for the general healthcare systems, so that we can strengthen our healthcare delivery in this country also.
What kind of surgeries do you perform in Unani medicine?
Actually, various surgeries are being conducted. If I talk about AMU Aligarh, they offer MS course in surgery also, and there they conduct hernias, operations for hernias also, hydrocele and other, I think hysterectomy and other things besides the gynecological or the obstetricial processes. Deliveries are also being conducted in these hospitals. In Tibia College also various surgeries of these herniorrhaphy or these hydroceles and I can say fistulas, anorectal problems, these are being conducted in Tibia College.
Thank you, sir. That was very nice of you to join us.